Doctor, let me tell you the steps that I utilize in training a parent to do the expansion in a jack screw appliance. Remember that these jack screw or RPE type appliances are very, very, very critical for any child who has any airway issues whatsoever. Let me back up and say a child should never be breathing through their mouth through parted lips, even a little bit of a parted lips, when they are playing, sleeping, thinking, studying. They should not be breathing through their mouth. Why? Because the nasal mucosa produces nitric oxide, and nitric oxide expands the vessels, the vasculature, and the alveolar sacs so that more oxygen is uptaken into the bloodstream and into the brain. So expansion, as I've said, is a very important and critical part of treating these children. Now, how do we teach the parent to do the expansion? Let me tell you. Number one, we show them the appliance on the cast, on the model, on the lab model on which it was constructed. And we show them how to put the key in, and we let them practice placing the key into the little jack screw on the model. We do not turn it on the model, because if we do, the model will resist and you can't actually turn. So we have them practice putting the key in, taking the key out. Then we turn the model upside down as if the parent is sitting behind the patient, just like we are at the chair, and have them practice putting the key into the model placed appliance. And so now they have a sense of how that key goes in and how it has the little stop and how it will be okay for them to put it into the appliance once it's in the child's mouth. Then we take the appliance off the model. Now, let me preclude by saying that before that parent even got there, we took that appliance and turned the jack screw to advance and back, advance and back, advance and back, 3, 4, 5 times. Why? Sometimes they're kind of sticky or hard to turn initially, and we want to make it looser and ready to go. So we already did that before the parent came into the room, before we started to do this process. Now we take the appliance off the model, hold it in the hand, keep in your mind where that was. In other words, if you're going to advance it or activate it one turn, which is 1/4 millimeter, of course, then you're going to go back each time for each advancement, because you want it back where it was to try in on the patient. Okay? So now you can allow the parent to actually turn it, and you can hold it and have them turn it in your hand so that you can see that they have an idea of what goes on. But I always, always, always then turn it back, however many turns they practiced. Okay, keep track, very important. Although you can adjust it later, but it's much easier to start out with it where it was. Now you're going to do a try-in for the patient. Remove the separators from the molars and place the appliance into the mouth on the teeth, seated all the way. Have the patient bite it down as appropriate, and then the parent can literally take your place at the chair, sit in your chair, and turn the appliance in the mouth. First, place the key, then make the turn. Once they seem to be relatively confident, and sometimes they're a little hesitant, that's okay. Tell them, assure them, in a day or 2 or 3, it will become very easy for you. And once they do that, they feel much, much better. And so you don't send them off wondering how they're going to do it, if they're going to do it, if they even know that it must go distally or posteriorly in the mouth. Sometimes they come back. I've had parents, I used to have a problem where they thought they were turning it rotationally rather than tipping the key and the little screw back in a posterior direction. So you want to be sure they know how to do it. Then you can remove it, dry it, plug the tubes with wax, and cement it in the mouth. Now, I want to tell you something. We have had, over my history of 25 to 30 years of making appliances like this and delivering them, I think we've had 3. Recently, we had one mom who said, "I'm just too nervous. And can I come in every day and have you do it?" And we said, absolutely you can. If she wants to make the effort and bring that child to us, and we told her Monday to Friday, we're not here on Saturday or Sunday, whatever days it was, then we would do it for her. Would we charge her extra? No. You know what? It's something we can give a nervous mom that supersedes her expectation, and it's a way we can love her and make her even more loyal. And don't forget, she's a nervous Nelly mom to start with, and she feels we have supported her in every way possible. And that's a good thing for her and for us. So we've had it happen. Believe it or not, in every one of my, I believe, 3 cases, maybe 4, I don't think so, we've had that mom, after a week, 2 weeks, maybe 3, say, I did it last night. I just wanted you to check it. Well, of course, there's not much to check because you can't see that she did an extra turn. But the bottom line is that they actually get to where they decide they can do it. And what we're doing each day when they come in is we turn it, and then after a few days we say, Mom, why don't you sit down and try it, and we'll back you up, don't worry. And if you don't want to do the turning, we'll do it, but just give it a try. Place it and see. So these are some thoughts for you on training the parent to do the expansion. We use rapid expansion every day on these children, mixed dentition, and early permanent dentition. So we're going to do enough turns to get them out of crossbite and into all but buccal crossbite, not quite buccal crossbite. We're going to do the most expansion we can without going into buccal crossbite. So those are some thoughts on how to train the parent. Have a good day. Good luck with this, working with these parents on expanding and transforming their child's lives forever. Dr. Chris, signing.